Taichung, a city with a population of a little over 1 million, is located in central Taiwan. In order to ensure that the people of central Taiwan, including all veterans, have access to medical services, the Veterans Affairs Commission of the Executive Yuan established the Veterans General Hospital, Taichung Branch, in 1982. On July 1, 1998, it was renamed Taichung Veterans General Hospital. The medical staff of this hospital provides excellent medical service with the core values of compassion, integrity, accountability, quality, teamwork, and innovation. New medical technology has been introduced on a regular basis in order to ensure that Taichung Veterans General Hospital continues to be one of the best medical centers in Taiwan. This hospital has established the Healthcare Quality and Patient Safety Committee, whose members include physicians, nurses, pharmacists, as well as specialists in medical and information technology to promote total quality management and continuous quality improvement with the twin goals of emphasizing medical quality and patient safety. The hospital has received many awards for medical quality and is widely considered to be well established in this field. One of the purposes of establishing this hospital was to provide medical care for veterans and their dependents, according to the Veterans Care Plan. Within 24 hours after a veteran is hospitalized, a social worker will make a ward visit and offer assistance. For veterans who need financial aid, social resources and free medical care are available. After a veteran is discharged, the nearest Veterans Service Department is notified to send a representative to his home to help provide comprehensive medical care. All patients can register for medical visits by telephone, online, or in person. Applications for copies of birth, death certificates, diagnostic information, medical fees, as well as medical reports can be made online on the homepage of the hospital. Inside the hospital building, there are direction lines on the floor to help people find their way to the right destination. During specific hours, viewing of newborns through a webcam is available by telephone appointment. Social workers help patients and their families cope with their emotional and financial needs. Volunteers also provide counseling service as well as helping patients in emergency situations or outpatients to seek medical care. In order to maintain a healthy community, neighborhood activities such as free health education seminars, osteoporosis examinations and counseling, CPR lessons, vaccinations, etc., as well as medical support to 5 sanitary stations such as Xinshi are provided. The Taichung Veterans General Hospital International Medical Service Center has organized and sent professional medical teams to many countries to provide free medical care and education. In addition, the hospital has accepted the invitation of the Ministry of Foreign Affairs of Taiwan to provide long-term medical aid to the people of the Republic of Nauru. To save energy, the elevators have been set to stop on every other floor. The lights in the hospital have been changed to the energy-saving T5 and LED. The filtered wastewater system of the dialysis unit and research building can provide water for laboratories, which helps to save 7,200 meters cubed of water and reduces the discharge of CO2 by 1,440 kilograms per year. We have adopted paper-saving methods such as an electronic official document system, electronic medical history, and e-meetings, which can save 450,000 pieces of paper per year and decrease hospital costs. Waste paper is sold and water recycled in order to reduce the use of incinerators and increase the income of the hospital. Taichung Veterans General Hospital has about 1,500 beds and provides care for over 6,000 outpatients every day. Equipped with modern facilities and well-trained medical professionals, it is dedicated to providing patient-centered medical care. The Department of Radiological Oncology provides radiological oncologic treatment and has advanced equipment such as cyberknife, tomotherapy, etc. to help treat cancer patients. The Department of Gynecology and Obstetrics has been appointed as the referral center for cervical cancer patients in central Taiwan, adopting the policy of prevention, screening, and integrated treatment. This department has treated around 10,000 cancer patients. The Neurosurgery Department uses the gamma knife and navigation system, guided microsurgery to treat pituitary tumors, which increases the precision and efficacy of the operation. The Hospice Palliative Care Team provides comprehensive care, including inpatient care, home care, combined care, and bereavement service for patients and their family who are facing life-threatening illness in the terminal stage. The Division of Allergy, Immunology, and Rheumatology is the first medical division of a hospital in Taiwan to combine the three specialties, allergy, immunology, and rheumatology. The medical team of this division has accumulated abundant experience in the diagnosis and treatment of a large number of patients with rheumatic diseases and systemic lupus erythematosus, SLE, and the quality of care has been attested to by patients. The Immunology Laboratory has received the TAF ISO 15189 accreditation and is also a paternity testing laboratory certified by the Department of Health of Taiwan. The Cardiovascular Center performs percutaneous transluminal interventions to treat acute myocardial infarctions, complex coronary artery disease, and valvular heart disease. Percutaneous transluminal radiofrequency ablation is used to treat cardiac arrhythmia. Cardiac resynchronization therapy, CRT, is a new method to treat heart failure, a condition which formerly was untreatable. The Division of Pediatric Cardiology treats congenital heart diseases by cardiovascular catheterization. Transcatheter closure of atrial septal defect guided by intracardiac echocardiography was introduced in our hospital in 2004, replacing traditional surgical treatment for pediatric patients. This hospital has established a Diabetes Health Promotion Center, which has advanced equipment and well-trained medical professionals. The medical team includes physicians, nursing, and nutrition instructors who provide integrated medical service to diabetes patients. It has been cited several times as an excellent diabetes care institution. This hospital promotes breastfeeding and has instructors to teach new mothers how to take care of newborns. We have been accredited as a mother and child-friendly hospital many times. Parents-child wards for newborns with moderate to severe illness provide instruction to teach parents how to take care of their babies. The McDonald Family House can provide sick children with a temporary home in the hospital. We introduced the Da Vinci robotic surgery system in 2005 to perform radical prostatectomy. With this system, the operation time and blood loss are decreased. The hospital stay is shorter, within 3 days. The possibility of incontinence is reduced, and preservation of sexual function is increased. The system can also simultaneously perform radical nephrectorectomy and cysturectomy in uremic patients with multifocal urothelial carcinoma, which is an innovative treatment developed by our hospital. The system applied to coronary artery bypass graft surgery can keep the sternum and ribs intact and greatly shorten the post-operative recovery time. We use the minimally invasive thoracoscopy on patients with lung and esophageal cancer, which can speed the post-operative recovery, alleviate the patient's suffering, and avoid complications. There is no wound using the endoscopy to treat vesicoureteral reflux, VUR, which can be done on an outpatient basis without the need for hospitalization. The success rate is about 92%. Using the endoscopy to treat scoliosis in the hospital's unique technique, the wounds are small and the patients can recover quickly with good outcome. We performed the first living-related donor kidney transplantation in our hospital in 1983, the first cadaveric kidney transplantation in 1984, and the first living-related donor kidney transplantation of incompatible blood matching groups in 2009. We performed the first liver transplantation in 1993. The one-year liver transplantation survival rate is over 75%. The youngest recipient of living donor liver transplantation was only 6 months old, and there was no complication. Our hospital has been assigned by the Department of Health, Taiwan, to provide care for high-risk pregnant women, as well as to handle the complicated cases of high-risk pregnancies in central Taiwan. Our hospital uses only auto cartilage to perform aesthetic and functional rhinoplasty. We also have an image-guided navigation system to help perform endoscopic sinonasal surgery. The Da Vinci robot surgery system is used for resection of tumors of the thyroid, larynx, and pharynx. We have also established a voice center with comprehensive services. A new lamellar keratomylosis transplantation technique is used to reduce the side effects of traditional surgery, which increases the risk of astigmatism. The patient can recover rapidly, and post-operative follow-up care is easy. The Dental Implantation Center provides accurate, good-looking, and durable prosthesis using excellent techniques. This hospital uses advanced imaging technology and facilities including CT and Multi-Detector CT to perform examination of the heart and vessels. An angiograph is available to perform intervention treatment for neoplasm embolization and thrombolysis. Nuclear medicine is the most advanced technology in modern medicine, providing accurate examination of the metabolic functions of the body. The positron emission tomography, PET, provides correct diagnosis, and our PET Center has won the Jinbor Award offered by the Public Construction Commission of the Executive Yuan, Taiwan. We provide patient-centered pharmaceutical services using an automated medication dispensing system and barcode technology to safeguard the accuracy of the medication dispensing procedure. We put much emphasis on medication safety for patients, as well as the teaching and research of pharmacy. Emergency medical services are available 24 hours a day, 7 days a week. Our hospital is also assigned by the Department of Health to be the Emergency Operations Center for the Central Taiwan region, which is in charge of overall preparation and deployment of the emergency medical services in Central Taiwan. The Department of Pathological and Medical Lab, which has received the ISO 15189 certification of the College of American Pathologists, CAP, and the Taiwan Accreditation Foundation, TAF, provides 24-hour frozen section examinations, key pathologic examinations of tumor therapy, and bedside pathologic cell suction service. We begin blood testing at 6 a.m. in the morning. With automatic equipment, we provide accurate microbiology examinations and zero-accident blood bank services for patients. The Psychiatry Department has set up acute psychiatric wards and daycare wards. We also provide service of psychiatric home care, child and adolescent, geriatric psychiatric medical care, methadone maintenance therapy, etc. We cooperate with the rehabilitation shop, The Beautiful Mind, to provide job training skills for patients so they can be reintegrated into society as soon as possible. We are committed to the training of young physicians so that medical techniques and the value concept of patients as the core can be passed on from generation to generation. We use the internet webcam system to facilitate long-distance diagnosis, teaching, and conferencing. There is also an e-learning platform which offers convenient, interactive learning opportunities. The physicians can use their ID cards to enter the 24-hour service library to conduct searches for information. The medical teaching of our hospital has been evaluated as outstanding, and our institution is considered as a model hospital in medical training. In regard to medical research, we publish over 200 research papers every year. The research team of Allergy-Immunology-Rheumatology has identified the allergens of the biting midge, Forcipomia taiwana, and has been designated by the World Health Organization (WHO) and the International Union of Immunological Societies (USIS) as 4T1, 4T2, and 4T3. We regularly conduct clinical trials of diabetes medicine so that patients can receive the most effective diabetic treatment. The Pediatrics Laboratory uses analytical techniques such as combined liquid chromatography, tandem mass spectrometry, for biochemical and genetic diagnosis. It is one of the few laboratories in Taiwan which specializes in diagnosis of rare diseases. The Enterovirus team of the Department of Pediatrics has found that the factor of Enterovirus 71 that accounts for the highest mortality is heart failure. Based on this finding, we have used the extracorporeal circulation technique to save the lives of many children, and related research results have been published in many international medical journals. The Multi-Detector CT team has solved the difficult problem of injection of contrast medium for CT angiography. We are experienced in using the Multi-Detector CT to diagnose newborn congenital heart diseases, and we have published the results in international medical journals. We have extracted mesenchymal stem cells from adult adipose and umbilical cord tissues, which can be used to treat chronic and degenerative diseases in the future. We use stem cells from all sources to study myocardial regeneration in order to provide a new treatment approach for patients who have experienced heart failure or myocardial infarction. The research department is dedicated to the development of medicine for liver diseases, which is extracted from plants in Taiwan. A U.S. patent has been granted for one product containing plant extract, and a company has been authorized to market the product. A study to clarify the reasons for allergy to latex gloves has revealed encouraging results, which is helpful to prevent the occupational allergic reaction. As we enter the second decade of the 21st century, Taichung Veterans General Hospital is proud to assume the responsibilities of a public medical center to safeguard the health of the people in central Taiwan. Our vision is to become the medical center in Taiwan which patients trust most, medical professionals admire most, and which sets an example of excellence in medical education, research, and management. To realize this vision, the entire staff will do their best to seek improvement and contribute to the health and wellness of all human beings.